about postnatal depression, which is defined as a mood disorder affecting most moms, up to 1 in 7, in that period just after birth up until baby is a year old. It's different from the normal baby blues everybody talks about, which is a feeling of irritability, tiredness that hits moms usually between day 3 and day 5 after birth. It's accompanied by lots of tears and emotions you're not able to define. Postnatal depression tends to last longer, usually goes a bit deeper. It also affects our moms that has been diagnosed with either mood disorders before or some kind of brain trauma before birth. They are the ones that are more likely to have postnatal depression or get hit by postnatal depression. So the typical symptoms and signs of postnatal depression, some of the mothers describe it as a numb feeling, an inability to cope with your everyday, despite the normal traumas and duties that come along with a newborn. You are extra tired, but unable to rest, unable to sleep, unable to switch off. You are overly concerned with your newborn's safety, with your newborn's development. Moms tend to struggle connecting with the baby. And a newborn does not rely on any verbal cues. They need emotional touch, that kind of connection. So if the mom is unable or feeling numb at that time, it also affects the newborn's development. Postnatal depression can also be seen as the start to later on depression, and multiple disorders, mental disorders. We usually see moms coming in feeling unable to cope with life, unable to speak to their partners, unable to cope with everyday stresses. And it is not by any means a weakness or a sign of your inabilities. It's nothing you did wrong. It's nothing you could have done better. There is very little you could have done to prevent it. We are at this point as healthcare professionals still not sure what causes postnatal depression. There has been connections to moms that have gone through in vitro, also moms that have been in very stressful situations or where the birth has not gone according to plan. Moms that usually have very good control about all parts of their lives struggle with that newborn that is unable to express why they're crying. So mom goes to a place where she thinks or reads up on what she's supposed to be able to do, and then finds that she's not, or defines herself as somebody that is not able to cope with the norms. And a lot of our moms come in and listen to therapy, listen to psychiatrists, psychologists, and then find out that this is a very prevalent disease that moms actually go through after birth. Very important. It can be treated by therapy. It could be a group therapy. It could be one-on-one therapy. It can be treated by medication. So your first step is to reach out to a professional, starting with your obstetrician, starting with your midwife, starting with your baby's nurse that's looking after your newborn, because they are usually ones that recognize the symptoms faster, and they're also able to direct you where to find help. It's also something that the partners or husbands or wives should be taught to look out for. because they are usually the ones that can pick up on the symptoms beforehand. And we need to encourage our partners to get us help when we are unable to get that help ourselves. So, firstly, reach out to a professional, even if it's just to say, listen, I'm experiencing this. Is it postnatal depression? Is it just baby blues? Because your baby blues symptoms usually last between 10 and 14 days. From day 5 until day 14, you are teary and unable because it is usually caused by that drop in hormones. Where postnatal depression can last very long until you've actually found the help that you need. Um, as a mother, as a new mother, you need people that can explain to you what you're going through, because this is something that could make you fear having another baby, having a second child, and then it can also affect you after your third baby, where you didn't have any of the symptoms with your first two, but then suddenly this hits you with your third baby. There is no indicators beforehand, but we do need to know that what the signs and symptoms are, and then also to search for help the minute you notice that you're going through some of these symptoms. The easiest part is to start talking to somebody, to start looking at your life and explain and making notes of the things that you're finding difficult to cope with, making notes of the things that suddenly seem so much heavier for you to do, where you usually cope with all of these things. And then also being realistic about the expectation, what you feel are expectations, and also what your partner might be expressing as his or her expectations from you. And then also including family members or good friends in that treatment process, in the time that you need assistance, where you make use of friends to either babysit and give you the break, or someone that you can just talk to on a regular basis, and someone that then will get to know the signs of you going into a depressive episode. Postnatal depression, once treated, does not need to haunt you for the rest of your life. It does not need to reoccur. It's never guaranteed that it won't, but it does not need to alter your experience as a new mom or the mom of a newborn. We would like to encourage our moms to talk about it, to talk about their experiences, to reach out to groups, to make use of social media. The Instagram, Facebook, there are so many groups these days, avenues. If you feel like you don't have the resources to reach out, firstly, join one of these mother groups. Sometimes there is valuable information shared in the groups. There are moms that is in the same position as you at that moment that can give you a direction of where to go. But also remember that your partners in this pregnancy and birth process is more than willing to assist. It's never meant for you to give birth and then struggle on your own. It is a community. We are seen as friends and family and a support group. When you deliver that baby, most people realize the difficulty of raising a newborn. It's like being somewhere, receiving a new machine to operate without any instructions, without a manual, and this causes so much stress. But some of our moms always think they should be superwoman and they should be coping. Mothering skills comes naturally, which doesn't. The stresses of breastfeeding, it can also bring along postnatal depression. It should never be confused with postnatal psychosis, which is a very dangerous syndrome which causes you to obsess, and where you can actually go over and hurt your baby, hurt yourself, hurt your partner. But if you are experiencing the symptoms I've spoken about and you feel like you could possibly be experiencing postnatal depression, please seek help. Please speak to your midwife. Please speak to your obstetrician. And they are the ones that usually direct you to where you get your help. And then also from there, you are involved in what your treatment will be. It is a treatment that is done on one-on-one basis. So it is no general treatment for postnatal. It is done individually, where you are being assessed and where you get continuous involvement from a professional. And it can turn around what might seem like a very daunting experience into a joyful road to follow. Having a newborn can be such fun. It can be such a joyful experience. It can be such a nice, lifelong, life-changing experience. But we must make sure as women, as mothers, that we take care of ourselves in order to take care of that little person.